Hello and welcome to today's webinar, The Power of Knowing the COVID-19 Vaccine Questions, Answers, and Concerns. This free webinar is part of a series called The Power of Knowing, created by AuthoriCare Collective, which empowers people to be active participants in their care journey, enabling them to live on their own terms through personalized support for mind, body, and spirit. And we offer today's webinar in partnership with Cone Health and PACE of the Triad. To get us started, I would like to welcome our moderator, Kiva Elliott. Kiva is a wife, mother, sister, and warrior for the underdog. Her faith is at the center of her life and family time. Girls' night out, long naps, and hanging with the locals when traveling brings her joy. She also happens to be Vice President and Chief Diversity, Equity, and Inclusion Officer for Cone Health. She has been a leader with Cone Health for over 9 years and takes pride in serving the people, patients, and communities of the organization. Kiva believes that small actions send a big message, and we all have to be willing to stand up, speak up, and take action for justice. Kiva, I turn it over to you.
Thank you, Paul. I'm so excited to be here at the next episode of The Power of Knowing. We all know that knowledge is power, and we want to make sure that we are helping to support that and making sure that we are giving you all of the information that we have so that you all can make an informed decision about getting the COVID-19 vaccine. So I am joined with 3 panelists today, and I will introduce them. And the first panelist is Dr. Carolyn Haraway-Smith, and she's a Chief Medical Officer for Women's Health at Cone Health. She is also a physician partner at the Center for Women's Healthcare in Greensboro and serves as physician director of the Center for Women's Healthcare at Cone Health's Med Center High Point. And Carolyn loves to travel. So I can imagine that over the last year, she's really been missing that. But she loves to travel. She's an avid reader. She loves doing outdoor activities, and she enjoys baking. And she has 2 sons and 2 grandsons. So I am sure that they enjoy the baking as well. So welcome, Carolyn. Next, we have Ursula Robinson. Ursula is an executive director with PACE of Guilford and Rockingham counties. And PACE is an acronym which stands for Program for All Inclusive Care for the Elderly. Ursula enjoys gathering with family and friends. She does hot yoga, and she loves walking on the beach, reading, and just spending time and checking in on family. Welcome, Ursula. And last but not least, we have Kamika Totten. And Kamika Totten began her career, her 20-year nursing career, as a bedside nurse at Cone Health. She eventually advanced to become a department director and now serves as the vice president of nursing at West Campus at AuthoriCare Collective. Now, Kamika loves getting pampered. So she loves spa days. And she specifically said spa days. So she wants to spend the entire day at the spa. She's a movie fanatic, and she loves Broadway shows and plays. So the Tanger Center is going to be the place to be for her when they open and she can get there. So thank you all for taking the time to be a part of this panel today. And I am sure that we will help to educate and give people what they need to make an informed decision about taking the vaccine. So I'm going to start with a question that I think will be very helpful for everyone. So we all on the panel have taken the vaccine. And I would like to ask if each of you could talk to me a little bit about that process. Talk to me about whether you were a early adopter and like, I want to be the first one in line, or you were thinking, well, I'm going to wait it out and see. So you had to go through some process before you decided to say yes. So if each of you can talk to me about that, that would be great. And Kamika, I'm going to start with you.
Right. So after doing a bit of research myself, I knew that I would get the vaccine, but I will say I was a middle adopter, if there is such a thing, because I knew that I would wait to see how some others did after receiving their vaccination. However, I will admit that I proceeded in getting mine quickly after my grandmother contracted COVID and passed away earlier this year at the beginning of the year. So before I went to her funeral, I wanted to go ahead and at least receive my first vaccination, which I had the Moderna, and I did really well from that vaccination.
Okay. Thank you, Kamika. And I'm so sorry to hear about your loss.
Thank you.
All right, Ursula.
Thank you. I must say, honestly, the first time I heard about the vaccine, particularly how quick it was produced, my red flags went up immediately. I recall a part of my process included praying, lots of that, thinking about it, and certainly self-education. I went to a number of websites, including the NAACP, the CDC, Guilford County Health Department, Cone Health, to read as much as I could about the vaccines for myself. And I also listened to lots of virtual webinars like the one that we're on today to help me with my decision. Spoke to a number of people that I trusted, physicians, nurses, pastors, church members. However, I must say the deciding factor for me was my 27-year-old pharmacy resident daughter who lives in Chapel Hill. And she kept saying, Ma, you got to take this vaccine. We've got to protect our patients and we got to get this virus in control. And then the kicker was when she said, and I want to come home for a home cooked meal. I miss those dinners. And I don't want to come home and feel guilty or worried that and somehow I'm going to make you and Dad sick. So please join me. And then the very next day, she sent me a picture of her taking the shot, and the sticker said vaccine ambassador. Just an enormous amount of pride came over me, and I made that decision at that point that I also wanted to be a vaccine ambassador.
Thank you, Ursula.
Quite welcome.
All right, Carolyn, you're next.
So I think we're probably all considered early adopters since we're well at the beginning of the process of the whole country being vaccinated. But for my team, I'd probably say I was in the early-ish category. I was very concerned about the way that the vaccine was described on the news initially. And so early on, I started doing a lot of research. I looked at all of the medical literature. I looked at how the vaccine was created and the process that the labs went through, who was in the lab. I just did a lot of research, which is how I ended up on this side of the message of vaccination recommendation. I was on a medication and I was a little bit worried about how the vaccine would interfere with that. And I wanted other people, not just my patients, but other patients within Cone to understand what that might look like. So you asked another question at the beginning, which is what was that experience like for us? And I'll tell you, so the first vaccine, you know, it was like a shot. It didn't hurt that much. My arm was a little sore, no big deal. Kept waiting for the shoe to drop. It never did, you know. And I had the Pfizer vaccine. I went back 3 weeks later and I got the vaccine at around 11 o'clock. Felt great, worked the rest of the day. At 7 o'clock, like on the dot, I started having chills. And I said, that's okay, I read about this. And I was just extremely tired. So I went to bed and I'd heard this would happen. It was in the literature. I wasn't afraid of it because I'd educated myself. And the next day at around 6 o'clock, I was back to normal and I got a full day of doing absolutely nothing and being catered to by my family. So the fact that I was educated really alerted me of what to expect. Most people don't have symptoms even like that. But if you do, you just need to know what to expect, and then it won't be frightening.
Awesome. Thank you. Thank you. So I'm going to do a poll now for our participants. And the question is, and I'm going to invite our participants to please take the poll so that we can understand where you are and who you are out there. So the question is, are you planning to get the COVID-19 vaccine? So if you can take a few seconds to take the poll, that would be great. Wow. So we got a lot of people that have already taken the vaccine. That is awesome. And we got some that are planning, and some are kind of on the fence, and some are just no. So so thank you. Thank you for taking that. And we're going to hopefully give you some information today that can help you if you're on the fence. If you're just a no, we're going to give you some information, hopefully, that can help you change your mind about that. But of course, it's totally your decision. All right, so let's get started here with some of the questions that we know are out there. And we know there are a lot of myths out there. There are a lot of things that have been going around, because in this age of social media, boy, information can get out quickly and it can be incorrect, and it's kind of hard to kind of track it down. So we're going to start with a couple of questions that we know that people have been asking. All right, so I'm going to start with you, Dr. Haraway Smith. So from a physician perspective, can you explain to us the benefits of being vaccinated?
So I'll take it personal before I take it from a physician aspect, and that is, for almost a solid year, I didn't go into a grocery store. I have a new grandbaby. I haven't seen him in person. A lot of my colleagues have been working from home, so it's been a really isolating time, and that's what I've seen in patients as well. And so when you look at the personal toll that this virus has taken, it's created a lot of adverse situations personally, right?
Mm-hmm.
But from a healthcare standpoint, there is an increased number of deaths. In North Carolina alone, we've had almost 600,000 deaths from disease related to COVID. And that is deaths that are above and beyond what would be expected for the usual year. So when you look at it in terms of that, it makes a huge difference, right? And that's only the deaths. So there's also increased what we call morbidity, which is illness. So people who have contracted COVID, and now they have chronic lung disease, chronic fatigue, and all sorts of medical conditions just related to COVID alone. And so those are the two kind of medical issues, but that doesn't account for the job losses related to that. And so that increases our risk of social determinants of health. So poverty, access to healthcare, food insecurity. So all of those things play into it. And so it's taken a really hard toll just on our population in the United States, and specifically in North Carolina.
Absolutely. Thank you. When we talk about it from a personal standpoint, I agree that we have just, our whole lives were just turned upside down, right? And the pandemic is what started that. Now, we had a lot of other stuff going on last year as well. So it was just, everything just kind of came together, but the pandemic really, really did cause us to have to pivot and just change the way we normally do things. And so we're glad that we have a vaccine, or a couple of vaccines, that we could definitely will help us to stop this pandemic. Kamika, I'm gonna turn to you now and talk about your teams. right, at AthoraCare, and your employees, and kind of what are you hearing, or what are they saying about the vaccine, or their hesitancy, or promise even about the vaccine?
So most of the staff who express concerns or hesitancy about the vaccination, they express those concerns about the amount of time that it took for those companies to produce a vaccine, as well as question the vaccine's effectiveness. So my response has been to educate those individuals regarding the fact that there were human clinical trials conducted. And in fact, I know a physician who participated in the Pfizer COVID-19 vaccine trial who shared her experience during that time. And I also share my personal experience with the Moderna vaccine.
Okay. So are you finding that, I mean, as far as the employee population or the staff, that most people are getting the vaccine, or you think you got a mixed bag?
We have a mixed bag definitely here.
Okay.
Definitely have a mixed bag. We are shooting for 70% of the staff to be vaccinated, and we are maybe near 30% at this current time for full vaccination.
Okay. All right. So we just gotta keep educating, right? We gotta keep staying out there and giving them the information that they need to help them. So
Absolutely.
all right. So Ursula, you know, with working for PACE, and your population is typically the elderly, is that right?
That is correct.
Yeah. So, you know, when we think about the nursing homes and we think about the elderly patients and that you're serving, talk to us a little bit about that and how they're feeling about taking the vaccine, and what do you think has been the determining factor for them as they decide the vaccine?
So let me do that by sharing a story, Kiva.
Okay.
As you said, we take care of older adults, and in our program, you have to be 55 years or older, and you have to have medical conditions. So all of our participants is what we call our patients, have health conditions. And so we made the decision early on that we were going to make sure that our participants who wanted the vaccine had access to the vaccine. And so we were going to go so far as to transport them if they need it for the vaccine. And I wanted to be the first one that they saw at the vaccination clinic. And I also wanted to be the first one in my organization to get the vaccine, because I wanted to be able to lead the way and show others, as others on the panel have done, that this is a safe vaccine. But what I'm seeing in our participants really vary across the board. From the very first day, the first gentleman that I saw in a wheelchair rode up to the vaccine clinic, and I said, "Why are you here, Curtis?" And he said, "I can't imagine anywhere else I would want to be, Miss Robinson. If taking the vaccine is going to help me get back to my PACE family, which I miss dearly." Let me add, we have fun over here at PACE. So I know exactly what he's talking about, because I miss him as well, and the rest of the participants. And so he said, "I'm willing to do whatever I need to do to get back to PACE." And so that was an easy message for me to give to the staff. If we've got frail older adults who are willing to do what it takes to get back to some resemblance of normal, that's the least that we can do, is do the same. But I've also got older adults who've said, "Absolutely not. I'm not going to do it." And what we're doing is trying to be supportive of them. And what they're saying is, "I'm concerned that my health condition, this vaccine will have a negative impact on it." I've also heard the conspiracy theorists talk about why they don't take the vaccine. Certainly, I have heard, believe it or not, people who believe that there are certain vaccines for African Americans and certain vaccines for other populations. So it's been throughout the gamut. But I would say the reason I'm hearing the most common reason, is people want to sit back and wait it out. They want to be the late adopters. See how these early adopters do. This one man said to me, "I want to see if you grow feathers first, and don't become a zombie." And you know, it's real. It's very real. And so what we have to do is just be understanding of people who have this hesitancy. And as you said, support them and educate them.
All right. Thank you.
You're welcome.
Thank you. Yeah, we have to use that inspiration that we can get from others to help spread the word and make sure that people have what they need.
Absolutely.
So the next question is for Carolyn. Carolyn, so we're hearing, you know, we got 3 vaccines now that are approved, right? So we have the Pfizer, Moderna, and the Johnson & Johnson. And there have been some questions about one is better than the other, and just people just trying to make the decision. Even some people are saying, no, I only want to take Johnson & Johnson, or I only want to take that. So can you share with us about the different vaccines and just talk a little bit about the difference between all three of them? And I don't think one's better than the other, but just to help people understand that.
Sure. So not to belabor you with the science, but to give you enough so you understand, the purpose of a vaccine in general is to go into your body and make your body think it has an infection of whatever type, and then let your body mount a response to that disease. And most of the vaccines that we're familiar with have live infection in it. So some of the flu vaccines have a little bit of the live vaccine, your body gets a little bit, and then it mounts up a reaction against the actual disease. All three of these viruses are different in that neither of them have any live virus. So the Pfizer, the Moderna, the Johnson & Johnson, none of them have active disease in it. So you cannot catch COVID from the vaccines. The Pfizer vaccine was the first one to come out. That and the Moderna vaccine are mRNA vaccines. Those are new in the United States, but they've been used in other parts of the world. Think of Ebola. So in the vaccine that they're making against Ebola, it is an mRNA virus, a vaccine, excuse me. I think the important thing to understand, again, without going too much into the science, is the platform for creating this vaccine was already underway. What was new was this actual specific infection. So if you have a platform for something, a basic recipe for a cake. So is it a yellow cake? That's fine. Oh, do I want chocolate? Well, then I add some chocolate. So do I want strawberry? Take out the chocolate, add some strawberry. So the basic cake mix was there. What's different are the additives. And so once you understand that the platform is there, you recognize that it really didn't take that much longer to really just make it a chocolate cake versus a plain cake, right?
Mm-hmm.
The thing that I was concerned about was, well, this whole Operation Warp Speed, who's paying for this? And, I was a little, thrown by some of the conspiracies as well. But the money that went into the Pfizer vaccine, for example, there were no governmental funds that went to Pfizer for the creation of the vaccine. Moderna did accept some federal funds, but the creation of the vaccine, again, the platform was already developed, and it's the same platform as the Pfizer. So the Pfizer vaccine has a 21-day window. It is a 2-shot process. So it's not like you get one and you get a booster. You get one, and the second portion of that series is 21 days later. For Moderna, it's 28 days later. Pretty much the same concept. The differences in effectiveness, not very different for both of them. And it's 95% effective against preventing severe disease. The J&J vaccine is a little bit different. It's a vaccine that's created based on it's called a viral vector vaccine. And so what they did was they took a virus, they denatured it, so there's no live components of it, and then they created a COVID or coronavirus from that. So that non-live virus goes into your system, your body thinks, oh, COVID, develop a war or an army against it, and all of them, within 20 days, the actual vaccine is out of your system. So once your body takes over, there's no vaccine left in your system to do any damage. They're gone. Your body takes over, and you mount an immune response to that. So in somebody with an immune disease like HIV, for example, or some other autoimmune illness, the vaccine might not be effective, because if your immune system isn't healthy, then the vaccine it's only as good as your immune system is, right? So that's kind of the nature of how the different ones work. That's a long answer, but I do want to address this. In terms of why we want people to get the vaccine, right? As a country, what is the significance of this? The significance is preventing severe disease and death. All of them do that at about 95% effectiveness, right? The difference for the J&J vaccine is that one, it's only one shot. You get one shot. And so it's easier to take into different communities. So I can put J&J vaccine in my briefcase and I can go to X church down the road and give 100 people the vaccine that's in my briefcase. I can't do that with Pfizer because it has so many requirements for how it has to be handled. And so it's a really cumbersome vaccine.
Right.
To do the same thing in terms of efficacy as the J&J virus vaccine. The J&J vaccine, though, doesn't have the same effectiveness in terms of preventing severe disease. So it prevents death at the same rate, prevents disease a little bit lower, that's in the 85th percentile. And then of any infection at all, it's only about 66% effective. So you might get a mild cold-like reaction or a mild flu-like reaction. But if you're not dying and you're not being hospitalized and you're not having severe disease, it has done what we needed to do to prevent that overall, we're worried about the deaths in our community, right?
Absolutely.
And so all of them work effectively to do that.
Thank you. Thank you. That's very, very good, because that's the kind of information we need to get out to the community, because and we hate to talk about myths, right? Because we don't want to repeat them. It's almost like you don't want to talk about them, but we've heard that the vaccine is going to alter my DNA. Well, we just heard that's not true, right? So we want to just kind of get those things out there and make sure that people understand the truth and the facts, right? So thank you for that. Very, very thorough. Thank you. So Kamika, I have another question for you. So we talked a little bit about your reasoning, right, behind taking the vaccine and talking about the death of a family member. When you are educating people on your teams or in your community, are you hearing them question the different vaccines and which one they want and which one they're not open to taking?
So I'll say much of the hesitancy for all three forms of the vaccine come from the amount of time that the vaccines were in trial, as well as those few conspiracy theories about alterations in DNA, which is not true, and then the microchip theory that is not true. And I think we should just address those concerns by sharing the facts as we know them at that time. So I often share my experience of the Moderna vaccine. I've heard a lot of jokes and memes about the Johnson & Johnson vaccine. Again, I believe that we should share the facts as we know them at that time.
Okay, well, good.
And Kiva, can I go a little deeper into the conspiracy about the changing the DNA? So in order to change the DNA of someone, you have to, one, be God, but or be able to splice into the DNA. There's a lot that you have to go through to change someone's DNA, but none of these vaccines go into the nucleus or the brain of the cell. And so that's the other piece that's very important. They all attack the wall of the cell. You guys remember this from biology, school, right? But the wall of the cell, it really doesn't count, right? It only keeps things in or out, but the nucleus of the cell, that's the part that counts, and it doesn't, none of them touch the nucleus of the cell.
Awesome. Thank you. Thank you. There's a question, and I just wanted to talk about this too, that when you, and we have about 70% of the people on the call today have taken the vaccine. So I'm sure everybody has different experiences, but talking about the side effects, right? And so, and it's going to impact everybody differently. But when you took the first vaccine, in my experience, I felt nothing. I almost thought they did not give it to me because I felt nothing until a couple of hours later, and then my arm was sore. And because I have severe allergies, I have very severe allergies, I had to wait 30 minutes after I took the vaccine just to make sure that I didn't have any reactions. And the same thing happened for the second one. But there's some questions around if you have severe allergies, or are there instances where you should not take the vaccine. And so, Carolyn, I would ask you to talk about that, and in particularly too about fertility and pregnant women, because that's a question that comes up often. So if you can talk about allergic, allergies, as well as pregnant women or women that, would like to have a baby at some point, they're questioning whether the vaccine is right for them.
So I want Kiva to know that those are two like this way questions. So
Yeah,
if I wax long, you guys will have to forgive me. So
Okay.
I'm going to attack the allergy question first, and I think
Okay.
it's very simple. Well, and I have to tell you a story. So when I had the vaccine, they make you wait. I think it's 15 minutes if you don't have allergies. And I
Yeah.
was like, well, where are the people who are supposed to help me if I have a reaction?
Yeah.
And they were like sitting in the back. They're like, we're here, and they held up EpiPens, right?
Yeah.
And so I was like, good. So if you have allergies, you let them know, and they will specifically figure out, and they'll let you know on site what are your allergies. And a lot of them do this when you register. What are your allergies? And if you're allergic to any component in that shot, they can give you a different shot. And I saw in the page, someone was recommended to get Johnson & Johnson because of the allergies. I think all of them respond the same in terms of allergies. So notify the site of what allergy you have, and then they will watch you longer, and they have EpiPens. And in the overall scheme of things, with thousands and thousands of shots, we've had very few allergies, and the EpiPens have worked for all of those. So now I'm going to shift to OB, and this really isn't that long. So we are recommending the vaccine for people who are pregnant. In fact, ACOG and SMFM, if you want to know what those are, catch me up on Facebook, but they're the organizations that license people in my specialty. And they've all put out arguments that go a little bit beyond, yeah, we think pregnant people should get it, to we think pregnant people should be considered high risk, meaning high risk and should be moved up on the ladder of people who should get it first. And that's because if you're pregnant and you get COVID, the infection, you have a higher likelihood of getting very sick from that. And I've seen some very sick people as a result of the COVID infection. So yes, we're recommending it, and we're recommending that people be considered high priority so that they don't get the infection and severe morbidity from it. And the last question is again one of those conspiracy theories that I don't even know sometimes where they come from. But again, because the vaccine, I keep saying virus, I apologize, but because the vaccine doesn't affect the nucleus of the cell, that means any cell. That means fetal cells, that means eggs, that means sperm. It doesn't affect the cells. And because it leaves your body so quickly, we don't see any reason for people to think of it as a reason to cause infertility. And again, I'm not really sure where that comes from. We have zero evidence of anybody having infertility as a result of this. And here's the bottom line. And I tell my patients who ask this, my goal is to I don't create life, but I bring life into the world as part of my specialty. I don't want to do anything to interfere with somebody getting pregnant or being able to have a baby safely. And if I thought that there was any question about that, I would shut this down like so quick. I mean, again, we're not compensated for doing this.
Right.
And so I would just tell people, no, don't get it. But we haven't seen that. And so that's sufficiently been debunked by the literature. And last thing, the CDC started, the ACOG, which is who licenses me, actually made a push to start studying pregnant people because there are pregnant people who want to be studied, were excluded in some of the studies. And so now they're allowing pregnant people to get into the trials so we can follow them all the way through. There are registries for pregnant people, and none of those registries have showed any untoward outcomes in pregnant patients or those with infertility issues.
Thank you. Thank you. That's very, very helpful because we have heard a lot about that. So thank you for speaking the truth on that, because we really need to make sure people get the facts about everything. Another question that has come up is, and any of you can answer because I'm sure you've been asked this question. So we're all vaccinated, and people, I've been amazed at what I've seen over the last week on the news and everywhere about people in their minds thinking that COVID is over, we're done, and they're hanging out and not wearing masks and not social distancing. So I just want to encourage people, we still have to practice the 3 W's, period. And I know that if we're vaccinated, so all of us are vaccinated, so we could get together, the 4 of us, on this call and not have to wear our mask. Is that correct?
No, I think we should continue to practice the precautions.
Yes, continue to wear your mask and continue to make sure that we're social distancing, because I think there's another myth out there that, hey, we got all these vaccines, we got so many people across the country that have been vaccinated, we're good. And we just want to make sure that we are telling people we are still in a pandemic.
Can we
And
talk a little bit about the why of that, Kiva?
yes, absolutely.
Yeah, so the why of that, and this is a little bit weird to understand, because if I'm vaccinated, why can't I just hang out with Kiva without a mask, and
Yep.
Ursula and Kamika, who I just met? What we don't know about the vaccine, we know what it does to the individual, but what we don't know is, can I, though, if I'm exposed to it, can I give it to Kiva? Can I give it to Ursula? Can I give it to Kamika? We don't know that. And so until we know that, we still have to not only social distance, not only wash our hands, not only wear a mask, but avoid those group gatherings, because when I see that on the news, I am sick.
Yeah.
And it's funny because someone recently invited me to do a health fair in a park. It was just something really public. And I said, well, I want to understand first why you're doing that right now, right? Because the patients aren't screened, no one will have on masks, they're inviting people to this mask. And so I think we have to just continue to educate that. I wish I could say 100% that once I'm vaccinated, I can't spread it to you. Unless and until we can say that, we still have to protect, I'm going to say this, our fellow man. It's very important.
Right. Thank you. Thank you. So we're going to open up now the questions to our audience and our participants. So if you do have questions, if you can please put them in the chat, and then we will ask those questions and get you answers.
Kiva, can I make a comment about the previous question that we just talked about?
Yes.
At our organization, we went full speed in terms of PPE for staff, the shields or the face protection, the mask, hand washing, screening, et cetera. And so now there's about 66% of us staff-wise who've been vaccinated, fully vaccinated. And the question from some is, can we ease up on these restrictions now? I had one young lady say to me, you know, one of the main reasons I wanted to get the vaccine is so I can stop wearing this hot mask and these hot shields, especially around other people who are vaccinated. And so I've shared with my staff, it's going to be a process still. Number one, we've got to get more people vaccinated before we can let down our guards. And two, it will be a step-by-step process. So maybe we will remove the face shields first, but we will continue with the mask, as you said, the 3 W's for sure.
Okay. Thank you. All right, so I'm going to start to ask a couple of questions.
Okay.
If you experience severe tiredness after the vaccines, does that mean your immune system was very low before the vaccine? So Carolyn or Kamika, anyone, you can answer.
No, just like any vaccine, some people have a reaction and some people don't. I will say the vast majority of people do not have a reaction, but a fair number of people in the study had just like that viral malaise or fatigue. And so that is not uncommon to have. It's common enough that we know that it's going to start, if it's going to start really, I think it's 7 to 9 hours after that second dose of the vaccine. And I've had, colleagues who've had it and they're like, whoa, I wasn't expecting this, I'm tired. And others, my mom is 79-ish. And she was like, I got it. I'm going to, walk outside with my puppy. So, I don't know why some people get the malaise and others don't.
Okay. All right. So another question. What is the recommendation for children and the vaccine and the age range?
So I feel like I've taken over your webinar, Kiva, but the Moderna and, well, the Johnson & Johnson is like 18 or over. One of them, and you'll have to fact check me, is 16 and over, but for children under 16, none of the vaccines are approved for them. And the good thing is we have not had a lot of severe illness in children at all. Even our neonates at the hospital, even if their moms are sick, they haven't been getting sick. However, they are vectors. I call children petri dishes, and they are really good at spreading that infection. So you do have to be careful. But no, the vaccine is not approved for them as yet.
So under 16 and under, no. Okay. All right. So Kamika and Ursula, you all will be able to answer this one. Have any patients over the age of 90 been vaccinated? And if so, how do they do with any of the side effects associated with the vaccine?
Okay.
Some people who have been over the age of 90 and been vaccinated, and they have the typical side effects. They're tired, and that is the body's natural response to any vaccination and creating an immune response to a virus.
I absolutely agree with Kamika, and I'd like to add that our medical director, Dr. Robert Culler, presented his mom as a case study to us one day on our weekly COVID call. She is 93 years old, lives in Charlotte in a skilled nursing facility, and she got her vaccine, and he said she did perfectly fine. So I think, just like Kamika said, it just depends on the individual, but we certainly have had our fair share of older adults, particularly those over 90, which happens to be, by the way, the largest percent of the population that we take care of here at PACE, who've had their vaccine and have done beautiful. Now, me, on the other hand, let me just comment that my second virus, I was out of it for a good overnight. It was the best sleep, though, Kiva, that I had in a long time. So besides the arm soreness and the tiredness overnight, I was fine.
Excuse me. That's awesome. Good. Okay, so this question, once you have contracted COVID-19, and I believe I have had it twice, once diagnosed, do I now have antibodies, and how long am I protected from the virus? So it sounds like this person has had COVID twice. So Carolyn, you want to help us with that one?
Sure. So the problem with natural COVID infection, there are many problems, but we have no idea how long those antibodies last. And we do know that natural antibodies do not last nearly as long as antibodies from the vaccine. So we've had colleagues here at Cone who have had infection, and when tested within, the 90-day period, there are no, in fact, some earlier than that, some even at 30 days, and there are no antibodies. So that's why in this particular person's situation, they were able to contract the infection twice, right? Because the antibodies didn't take, and we don't know why the natural antibodies are less. And so we do still recommend the COVID vaccine in individuals who have had the COVID infection.
And from what I'm aware of, there are mutations in the virus. So just because you've had it one time didn't mean that you got all the different strands that are out there.
Yep, good. All right, so we have several more questions. I want to get to them. So why do I have to give my insurance information if this is a federally funded vaccine?
You actually do not. And so there is that question on the top of some forms, and you can simply avoid it. You do not have to get it. They are completely free. And that, I don't know who decided to put that there, but it is confusing for people, but you do not have to fill that out.
Awesome. Good, good, good. Does the vaccine affect breastfeeding?
Not at all,
Okay.
for the
All
same
right.
reasons that we described, but
That we
no, it
talked about
doesn't,
before.
it doesn't decrease milk supply. And we haven't seen virus in the milk. I will say one other thing about pregnancy. We have had recently some evidence that the vaccine actually produces some immunity in babies, but more to come on that. So that would be a very good thing if we could prove it. We have seen it in a few babies, but more studies to go on that.
Okay. This question, it comes up a lot too. And the question is, are the first and second doses identical to each other? So when you're taking Pfizer, we're talking Pfizer and Moderna now, what's the difference between the two doses?
Absolutely nothing. So they're the exact same dosage. The timing is different based on Moderna versus Pfizer. And again, Pfizer's 21 days, Moderna's 28 days. We have had a few instances where people got all of their vaccine at one time, and patients just couldn't tolerate it. You know, that immune response, if your body kicks in, it's like, oh, I've got to fight this. It was extreme. And so that's one of the reasons that they're separated.
Okay. All right. So this question is about the AstraZeneca. So I'm a part of the AstraZeneca clinical trials and cannot get the vaccine, but I have and will continue to encourage others to get vaccinated. Do we know how long it lasts in the body and if it is a yearly or semi-annual vaccine?
So if you're speaking specifically for AstraZeneca, I don't have as much information of that because that has not received emergency approval. And I'll tell you this for all of them, we don't know. So I'm always happy to tell people when I don't know something. And we don't know because that isn't known. We don't know how long these antibodies will last. And that's why this is all emergency use. So everyone who gets the vaccine, it's for each of them, it is recorded and everyone is followed. So if you have symptoms or if something happens, we're all going to know about it, you know, at once so that we can know how we should proceed. So they'll continue to follow that study group for how long that immunity is lasting. And then we'll determine if a booster is needed at a year, at 2 years. My hope is that we will have herd immunity at some time and that we won't need it, that none of us will need it, but we don't know fully right now.
Okay. So this question is about quarantining. So what is the process for quarantining prior to visiting family? If I get a test and continue lifestyle or quarantine totally before and after arrival. So I guess they're saying they take a test and how long do they need to quarantine before they can go and be with their family, I guess. What do y'all think?
I think we might have lost Kiva there briefly. Could somebody step in and maybe, I think, see, we have a question in the chat. Are those with autoimmune conditions at risk or increased risk of side effects?
Is Dr. Haraway, is she still on?
I don't know what happened with that.
Oh, okay, there you
Yeah,
are.
it just went, yeah. So is everybody back now?
I'm
Okay.
sorry, you were asking something and I completely got logged out. So
Okay, okay. That's no problem. So we were talking about quarantining, right? After you get the vaccine, should you quarantine before you go and see family members? So that was the question.
So that's a little variable now, and the vaccine has changed that a little bit. So if all parties are not vaccinated, it's somewhere between 10 to 14 days, so it's pretty long. New Zealand, who's had the lowest rate of transmission of virus, you go into New Zealand, 2 weeks that you are quarantined before you can roam about the country, and they've had low disease. And so if you're really wanting to be careful, it's about that long after a negative test. With COVID, it's a little bit different. So if you have been vaccinated and the family that you're visiting has been quarantined or vaccinated, so a grandparent wanting to visit their grandchildren, then you're relatively safe there, again, assuming that they've been isolated and not out and about going to Florida at the beach, then you're pretty good. We still recommend mask, hand washing, and social distancing during that time, though.
Yes, absolutely. This is another question here. With those with autoimmune conditions, are there risks or increase in the side effects to the vaccine if they have an autoimmune condition?
Yeah, so there's no increased risk to the vaccine. And in fact, those groups especially need the vaccine because you already have a decreased ability to fight infection. And so this helps your immune system to boost the response. Having said that, the vaccine is probably less effective than in a person with a healthy immune system, simply because the vaccine works to boost your natural immune system. And if your immune system is low, then you're going to have less of a reaction. But again, no adverse reactions from the vaccine itself in that category.
In that category. Okay. All right, that looks like that was all of the questions that were in the chat and in the Q&A. So as we start to wind down this webinar, which I want to thank you all for being so transparent and just open about talking about the things that people really need to know about. So I appreciate that. But if you could leave everyone with one thing about why getting this vaccine is helpful, or anything that might help them to cross that line of maybe or no, I want to invite you to do that at this time. So Kamika, I'll start with you.
Definitely, I would encourage everyone to be a part of the change. Help us to fight this virus.
Thank you. Ursula?
Oh, I'm so glad you asked that question. So what I'd like for people to remember is a lady named Claudia, who is a dear friend of mine. She is a Latinx, and Claudia and I have been talking about she and her family getting the vaccine. And what her response to me has always been is, you know, Ursula, I'm healthy, I'm strong, I don't have any health conditions, I don't see any need, and I don't want to get in front of those people who really need it more than me. So luckily for me, Claudia found out about an effort to have Latinx people vaccinated. And so she went to the FEMA program, or down there at the vaccination center, and she called me, and she was just crying profusely. I couldn't understand a word she was saying. And I was like, what's wrong? And she said, when she finally got herself together, she said, I went through the line. I was strong like I always am. And then as I was sitting and waiting, you know, because they have you wait for a few minutes, my emotions took over, and I just started crying, and my sister's with me and she couldn't console me. And finally I was able to say to her, the reason I'm crying is because I'm so grateful. So Claudia mentioned to me that, of course, her family is from Mexico and they are not able to get the vaccine. And her elderly parents have been waiting all this time to get the vaccine. They have health conditions. And so here she is in America with the ability to get the vaccine when so many people in other countries do not have that capability. And so she was just so full of gratefulness. And so I hope others will remember that we are truly blessed to have the opportunity to take the vaccine. Thank you.
Thank you. Thank you, Ursula. that really warms my heart. You know, okay, I won't get on
I
my
know.
soapbox here. So
Go for it,
yeah,
Kiva.
Carolyn, you're next.
One of the important things is, even for people who are healthy and aren't worried about what the virus would do to them personally, although I'll give a subscript and say we've had several people who were healthy and had no underlying medical conditions get very ill, and some of them die. And so it's a gamble for yourself. But the other piece, even if you want to take that gamble for yourself, consider others. And it's that whole adage, love thy neighbor as thyself. And so it may not be something that you do for yourself, but consider what it might mean to someone else to get vaccinated.
Absolutely. Thank you all. You know, we have to look out for each other, right? And like you just said, we are helping others when we get that vaccine. And so I'm just really encouraged that we have so much opportunity here to get the vaccine. And I think you all will agree with me. We don't care where you get the vaccine. You can go to the FEMA site, you can go to Walgreens, CVS, Cone Health, wherever. Just take advantage of the vaccine and get all the information you need. And we're here to help to provide you with information and facts. So we're just encouraging you to really consider it and make an informed decision about getting the vaccine. So that really concludes our session for today. And I want to thank you all of the participants, all of the great questions. We really enjoyed being in service of you today. The Power of Knowing is a series, and I want to invite you all that the upcoming Power of Knowing events on April 22nd, Making Your Story Known. It's about advanced care planning. And May 18th is Caring for Veterans. And you can get all of that information at authoricare.org/knowing for details on future offerings and recordings of past presentations. So thank you all again. And we will just keep fighting and keep making sure that we're getting the word out there and helping people get what they need. So thank you for your time.
Thank you for
All right.
moderating, Kiva.